Every second, 4 babies are born throughout the world. That is 240 per minute, 14,000 per hour, 345,000 per day, and approximately 140 million every year. Each baby is one of a kind and will make their own unique mark in this world. Some will be artists, some athletes, some scholars, some teachers, some scientists, some nurses, and some firefighters. But no matter what path in life they choose, each baby deserves and needs a healthy start for a bright future. Having a healthy baby begins well before a woman becomes pregnant. In order to have a healthy baby, a mother's body needs to be in good health and have the nutrients needed to form the first building blocks of life. Half of all pregnancies in the United States are unplanned. For this reason, many women do not know they are pregnant during the first few months of pregnancy. This can be harmful to the unborn baby because there are things a pregnant woman needs to avoid during pregnancy to prevent certain types of birth defects. The first 3 months are very important to the lifelong health of a baby. During this time, the organs they will need for the rest of their lives are forming. At 4 weeks, the fertilized egg begins to take the shape of the letter C. Buds, which will later become arms, begin to appear. What will become the eyes and ears are now present, and the mouth begins to form. At 6 weeks, the heart begins to beat and the embryo measures 1/8 inch, which is about the size of 1 grain of rice. At 8 weeks, the arms and legs are more defined, and they begin to move. The hands begin to develop fingers, and the feet toes. At 9 weeks, all organs needed for survival have begun to develop and will continue to develop throughout the pregnancy. During this time, the embryo is at high risk of developing birth defects. Later in the video, we will discuss some of the steps you can take to prevent birth defects. If you are pregnant or at risk of having an unplanned pregnancy, the following recommendations can help you have a healthy pregnancy and avoid preventable birth defects. You are at risk of having an unplanned pregnancy if you have begun to menstruate or have your period and are having unprotected sex, that is, sex without a condom or other form of birth control. Tips for a healthy pregnancy. Maintain a healthy weight. Women who are overweight are at greater risk for gestational diabetes, pregnancy-related blood pressure, premature delivery, cesarean section or C-section. Being underweight or malnourished is also harmful to both the mother and the unborn baby. Eat nutritionally balanced meals. Good nutrition provides vitamins and minerals the baby needs to grow properly and protects the mother's supply from being depleted. In addition to a balanced diet, take a prenatal vitamin daily and take at least 400 micrograms of folic acid. Folic acid is known to prevent spina bifida, a birth defect in which the backbone and spinal canal do not close before birth. Stay physically active. Physical exercise will help maintain a healthy weight. Staying active is healthy and safe for most pregnant women. Exercise helps build your energy and stamina for childbirth. Try to get 30 minutes of aerobic exercise on most days. Get prenatal care or a preconception checkup. If you are pregnant, keep all of your prenatal care appointments. Regular prenatal care helps you and your healthcare provider monitor how your pregnancy is going. your provider will perform prenatal tests to ensure your baby is growing healthy. It also helps spot any potential health problems before they become serious. If you are planning to get pregnant or at risk of an unplanned pregnancy, schedule a preconception checkup with your doctor. Preconception health care is care given to a woman before pregnancy to manage conditions and behaviors which could be a risk to her or her baby. Avoid teratogens. A teratogen is any substance that can disrupt embryo or fetal development or cause birth defects. Avoid teratogens including smoking, alcohol, and drugs, as these can cause severe birth defects. Alcohol is the leading cause of preventable birth defects in the United States. 1 in 8 women drink alcohol during their pregnancy. Alcohol use during pregnancy is responsible for 40,000 babies born with fetal alcohol spectrum disorders every year. What are fetal alcohol spectrum disorders? FASDs is the name which describes the range of effects that can occur in an individual whose mother drank alcohol during the pregnancy. These effects may include physical, mental, behavioral, or learning disabilities with lifelong complications. Fetal alcohol spectrum disorders have 3 subcategories. The first is fetal alcohol syndrome, which is the most severe of the disorders. There is also alcohol-related birth defects, ARBD, and alcohol-related neurodevelopmental disorder, ARND. What is fetal alcohol syndrome? Fetal alcohol syndrome is the most severe form of fetal alcohol spectrum disorders. Children with fetal alcohol syndrome show 4 distinct signs that include slow growth, brain damage. Many times the brain damage is so severe that it causes mental retardation. Prenatal alcohol use of the mother. Facial deformity. There are differences in facial features that make fetal alcohol children look different from other children. Fetal alcohol syndrome varies from child to child. Some suffer from certain effects more than others, and each child shows a unique combination of signs and symptoms. However, the more alcohol a mother drinks, the more severe the case of fetal alcohol syndrome her baby will experience. Remember, every drink makes a difference. It's never too late to stop drinking alcohol. What is alcohol-related neurodevelopmental disorder? ARND is a disorder caused by prenatal alcohol use which does not show the facial features of fetal alcohol syndrome. Those with ARND look physically normal but have thinking, behavioral, and psychosocial problems. Individuals with ARND demonstrate the following: difficulty with math and abstract thinking, poor attention and concentration, poor memory, lack of good decision-making skills, fail to consider consequences, hyperactivity and impulsivity, inadequate social skills, conduct problems such as lying, stealing, lack of cooperation, social withdrawal, teasing and bullying, and a range of other learning, social, and psychological problems. Like all fetal alcohol spectrum disorders, ARND affects each child differently. Each child will have a unique combination ranging from mild to severe. As adolescents and adults, those affected by ARND have a host of problems including mental health problems, alcohol and drug addictions, inappropriate sexual behaviors, dependent living, and trouble with the law. What are alcohol-related birth defects, ARBDs? Alcohol-related birth defects describes the physical defects linked to prenatal alcohol exposure, including heart, skeletal, kidney, ear, and eye malfunctions. The type and degree of birth defect will determine what kind of life he or she will be able to have. Some babies affected by ARBD die shortly after they are born. Others undergo intensive surgeries during their first years of life, and some will require ongoing medical care for the rest of their lives. While medical care may improve how long these infants live, it will never repair the damage caused by the alcohol they were exposed to in the womb. Tips for an alcohol-free pregnancy. Find a support group. Find a buddy you can be accountable to. Surround yourself with those who support your choice to have an alcohol-free pregnancy. Avoid places or situations where you usually drink alcohol. Write down how much and how often you drink. Keep in mind drink sizes. One mixed drink with 1.5 fluid ounces of 80 proof liquor such as vodka, gin, scotch, bourbon, brandy, or rum is considered one drink. One drink of wine is 5 fluid ounces. One drink of beer or wine cooler is 12 fluid ounces. Talk to your healthcare provider. Your doctor wants to help you have a healthy baby. He or she will not judge you or get you in trouble. Trust your healthcare provider. They can be a great resource to help you achieve an alcohol-free pregnancy. Don't feel ashamed to get the help you and your baby need. Staying away from alcohol can be hard, but if you are ready to give your baby an alcohol-free pregnancy, remember the following. Make the decision to stop drinking alcohol today. Get the support you need by getting help from family, friends, support groups, and most importantly, your healthcare provider. If you relapse, don't feel discouraged and give up. It may take several attempts before you get in the habit of saying no to alcohol. And most importantly, remember that you can do it. Your baby is counting on you. There are many organizations available to help you get the tools and support you need. A few are provided at the end of this video. To find additional help, talk to your healthcare provider. Call your local health agency or search the internet for services in your area. There are many resources and support available to you. Seek out the help you need today.